So today I'm going to discuss about a very high yield topic, that is a rheumatic heart disease, right? So before discussing the rheumatic heart disease, because rheumatic heart disease is there is overlap, immunology, microbiology, and some we also discuss in the session some flow charts. Okay, so rheumatic fever is caused by which microorganism? Streptococcus
But
pyogenes, right?
origins.
So this
Yes.
streptococcus pyogen lead to the rheumatic fever, and this chronic rheumatic fever lead to the rheumatic heart disease. So which type hypersensitivity reaction is? Type
Type type two.
type 2 hypersensitivity reaction. Okay. So the
Yes.
streptococcus pyogen does not only cause the rheumatic heart disease, but it also causes other things like it may cause the pyogenic infections, toxigenic problems, immunological. So I'm discussing only about the rheumatic fever. Like the pyogenic, it may be impetigo, right? Skin infections mainly. Impetigo, cellulitis, pharyngitis, these kind of the stuff, right? Toxigenic, toxigenic included scarlet fever. Although these things are high yield, scarlet fever and toxic shock syndrome, and necrotizing fasciitis, necrotizing fasciitis, right?
Yes.
Okay, so the rheumatic fever is an immunological problem that is due to Streptococcus pyogenes infection. Okay, so it is a type 2 hypersensitivity reaction. So the type 2 hypersensitivity reaction is antibody mediated, right? It is an antibody mediated. And this rheumatic fever is a phenomena of the molecular mimicry. Molecular
Mimicry.
mimicry. So this is again a very high yield molecular mimicry. So what happens? So this step pyogen has a M protein, right? M protein. M protein protect this organism from phagocytosis, right? So what
Yes.
our body do? Our body do our body produce antibody against this M protein. So antibody again this M protein. So this M protein resembles with myosin and tropomyosin. Myosin and tropomyosin. So initially body destroy this microorganism M protein, but when the disease is progress, what happens? Our body attack on myosin and tropomyosin as well. So they are present in the heart and other areas as well. So in this way, it will lead to carditis and valvular problems, right? And this is
Yes.
known as a molecular mimicry because the M protein resembles our cardiac tissues, right? Cardiac cells, and mainly myosin and tropomyosin. So this antibody not destroy the M protein of that bacteria, but also destroy the myosin and tropomyosin of the cardiac cells, right? And in this way, it will lead to the rheumatic heart disease. Does it make some sense?
Can you please repeat that part?
Okay, I am
Leading to the
again
rheumatic
repeating
heart
this.
disease.
So the streptococcus pyogen lead to rheumatic fever. This rheumatic fever is type 2 hypersensitivity reaction, right? So the type 2 is
Yes.
basically antibody mediated hypersensitivity reaction. Okay, so what happened? This step pyogen has a M protein, right?
Yes.
So what our body do? Our body produce antibodies against this M protein. Antibodies against this M protein. This M protein, this M protein resembles with myosin and tropomyosin. So this antibodies does not destroy only this M protein only, but it also destroyed this myosin and tropomyosin, right?
Yes.
Because it's structural similarity, and this phenomena is known as a molecular mimicry. Okay. So sometimes they give you the vignette of the rheumatic heart disease and they want to know about the pathophysiology. Sometimes the answer is a molecular mimicry. Sometimes the answer is antibody mediated. Sometimes the answer is antibody against myosin and tropomyosin and M protein. This is a very, very high yield concept, right?
Okay.
So the rheumatic heart disease is a consequence of the pharyngitis. So the streptococcus pyogenes may lead to cutaneous infections, right?
Yes.
It will lead to the cutaneous infection as well as pharyngitis. So this pharyngitis mainly increase risk of rheumatic fever mainly, but it also lead to
Nephritis.
glomerulonephritis. So sometimes they give you this kind of stuff. Sometimes they give you the streptococcus pyogen infection, cutaneous infection, and they want to ask about that is this increased risk of rheumatic fever or not. So the cutaneous infection of the streptococcus pyogenes only risk of glomerulonephritis, right?
Okay.
Glomerulonephritis. Okay. So keep this thing in mind, right? Another important stuff that is a very, very important. So the type 2 hypersensitivity reaction is a very important because all of the hypersensitivity reactions are the high yield. So I'm giving you the example. Sometimes they give you I'm the type 2 myasthenia gravis, right? Grave disease. So their pathophysiology is similar to the rheumatic fever. Why it is similar to the rheumatic fever? Because there are also example of type 2 hypersensitivity reaction, right? So I'm
Yes.
going to discuss the detail in the next month. Hypersensitivity reaction in detail. They are high yield stuff. So I'm giving this example how they ask USMLE this kind of the stuff. Myasthenia gravis and lot of other things. Goodpaster syndrome, they are all the example of the type 2 hypersensitivity reaction. Another important thing is the age of the patient. If it is less than, this is a general rule. This is a general rule. If it is less than 25 years, it means which lesion. So the rheumatic heart disease, the most common valve that is involved in the rheumatic heart disease is a mitral valve,
Mitral. Yes.
right? So if
Yes.
the patient age is less than 25-year old, so which lesion is present? mitral valve regurgitation. So MR is present. So initially rheumatic heart disease present with the mitral regurgitation. If chronic untreatable, chronic chronic rheumatic heart disease present with mitral stenosis.
stenosis.
If age is more than 30, this is a general rule to help you to the
Okay.
identify. The USMLE ask this kind of the stuff as well. They give you the age and typical vignette of rheumatic fever. So sometimes I give you the example of that vignette. So dyspnea, progressive dyspnea plus orthopnea, okay, and palpitation. One more thing, the patient is immigrant and age is 40. Okay, so they ask about which of the following is valvular pathology is preceding for this patient, right? So preceding means mitral regurgitation. They are not asking about the mitral stenosis. Mitral stenosis present in this patient. But what is the preceding valvular pathology? It's a mitral regurgitation. If they are asking about the present valvular problem, then it is mitral stenosis. I hope it I hope it makes some sense for you. Anybody has
Please repeat that. Yes, please repeat that differentiation again. You are breaking up
okay,
whilst explaining.
I'm saying that 50-year-old male immigrant
Mm-hmm.
dyspnea orthopnea palpitation, right?
Yes.
So the pathology is mitral stenosis because the age is more than 30, right?
Yes.
So what is the preceding valvular disorder in the childhood in in the childhood of that patient? It's a mitral regurgitation because
Regurgitate. Yes.
childhood, this patient from the childhood has suffered from mitral regurgitation because the initial region of the initial problem in the rheumatic heart disease is mitral regurgitation because this child is suffered from the mitral regurgitation and with the passage of time due to the scarring of the valve it will convert into the mitral stenosis predominantly, right? Okay, so can somebody identify this picture, this kind of the picture as well? Scenario plus picture.
Yeah, yeah, that
This,
would be a strep.
these are the chains.
The chains,
These
the
are chain or
streptococcus.
pair of the streptococcus pyogen, right?
Yes.
Okay. Okay. Now again, I'm going to discuss about some algorithms of the gram-positive bacteria. The gram-positive bacteria mainly divide into the three types: bacilli, cocci, and branching filament. I'm not going to detail in the gram-positive bacteria, right? So gram-positive bacteria, cocci. If it is catalase negative, it is streptococcus. If it is catalase positive, it is staphylococcus. Staphylococcus present in clusters, this kind of the clusters, and streptococcus present in the pairs and chains. These are the pairs or chains. Okay, so streptococcus further divided into the three types: alpha alpha hemolytic bacteria, beta hemolytic bacteria, and gamma hemolytic bacteria. So the beta hemolytic means complete hemolysis of the colonies. So beta hemolytic divided into the group A and group B. So this group E step pyogen lead to the rheumatic fever, right? And this is vasopressin sensitivity and PYR positive. Sometimes they give you the clinical vignette and they know about these kind of the things. is a gram positive cocci, catalase negative, beta hemolytic, and bacitration sensitivity positive. And you have to identify the streptococcus pyogen. Streptococcus pyogen is also known as a sept group A, right? And this group beta, septaglacia is most common cause of neonatal meningitis. This is again high yield stuff. Most common cause of neonatal meningitis. Okay, so this is, you have to identify the bacteria using this flow chart, right? It is a very, very high yield. Okay, so this is the Jones criteria. So the Jones criteria used for the diagnosis of rheumatic heart disease.
Rheumatic fever. Okay.
Okay, so this is used for rheumatic heart disease, right? So
Yes.
these are the major, these are the minor criteria. So major include joint, carditis, subcutaneous nodules, erythema marginatum. Sometimes they give you the picture in the USMLE question, erythema marginatum. These are ring-like lesion, skin lesions, sydenhemorrhea, right? These are the irregular purposeless dancing-like movements. Okay, so minor is fever, arthralgia, elevated ESR, CERP, and prolonged PR interval, right? So the Jones criteria used for the rheumatic heart disease, and what is the Duke criteria is used for which disease? Duke, modified Duke criteria for infective
Infective
endocarditis,
endocarditis.
right?
Yes.
Okay, we will discuss the treatment uh, after the few slides. Okay. Okay. So these are some pressure volume loops that are again a very high yield, because uh, sometimes they give you the scenario and you have to identify the pressure volume loop, right?
Yes.
Although we already discussed about these kind of things, but this is again a repetition and very, very high yield thing, right? Okay.
Okay.
So if the patient, let's suppose 12 month 12-month child comes with hollow, uh, so 12-month child come with uh, hollow systolic murmur plus migratory polyarthritis and all of the clinical feature of that are included for the rheumatic heart disease. What will you expect in the pressure volume loop of that child? A or B? A or B?
B.
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 Sorry?
B.
B. So what is the
Yes.
region? It age, on the basis of the age. It is a MR or MS.
Yeah, MR.
MR.
Yeah. Mutual regard. There's going to be increase in diastolic volume.
Okay. So it is 12-month child and it is MS. Oh, sorry, it's MR. Sorry, it's MR. Early lesion MR. Right?
Yes.
Okay. So MR, which picture shows the pressure volume loop of the MR? It is
B.
it is B.
B.
B. It's B, right? So now,
Yes.
so what happened in the regurgitant lesion? This black line show this is end systolic volume, right? This is normal
Yes.
and diastolic volume, right? So this is stroke volume formula is and diastolic minus
And
and
systolic.
systolic. Okay, so this is in mitral regurgitation, this one. So what about end diastolic volume? It is increase, and
Increase.
Increase.
diastolic volume is increase. What about
And systolic volume.
and
And
systolic volume?
systolic.
Unchanged.
A
Yeah,
decrease.
unchanged.
Slightly
No?
decrease. It's
Decrease.
slightly decrease, and systolic volume. So what about the stroke volume? Sometimes they give you the what, sometimes they give you the arrows. What happened to the stroke volume? What happened to the end diastolic volume? What happened to the end systolic volume? They are the most difficult question in the USMLE. Trust me. So
Yes.
stroke volume, increase stroke volume, right? In
Yes.
mitral regurgitation. This kind of the clinical scenario, increase stroke volume, right?
Yes.
So this is again, this red line shows about aortic pressure, and this is shows about left atrial pressure. So this is left atrial pressure, and this is aortic pressure. So you noted that this is this is the systole. This one is the systole, and this one is a left ventricle pressure. This one, right? So what happened in the systole? There gradual increase in the left atrial pressure because of the regurgitant, right? When the left ventricle contracts, blood move back into the left atrium, and this increased blood in the left atrium lead to this wave. This is a tall V wave, right?
Yes.
So this makes some sense for you.
Yes. Now I have a question.
Okay.
Okay, so the tall V wave is because of the regurgitant effect that's taking place. So a percentage of the blood in the left ventricle during contraction is going back into the left atrium,
Because the
right?
valves are, yes, because the
Yes.
valve are, because the mitral valve is incompetent, they are not
Yes.
complete closed
Yes.
during the systole of the
Correct.
left ventricle. That's why the blood move back to the left atrium, right?
Correct. Yes. Now, based on that principle, is it also fair to say that we can expect an increase in the ejection fraction?
Okay, so what about the stroke volume is increase or decrease?
Stroke volume would increase.
What is the ejection fraction?
Yes, so we're looking at the percentage of blood that is being pumped out of the left ventricle to the aorta for supply to the rest of the body.
I think the ejection fraction will also be increased because the stroke
Increase,
volume is
yeah.
increased.
Okay.
Okay, so another scenario, right? A 45-year patient comes with the progressive dyspnea, orthopnea, and occasional palpitation. Occasional palpitation. Okay, which of the following thing? Which of the following thing? Which of the following thing indicate the severity of the valvular pathology? Which of the following things indicate the severity of the valvular pathology? So this is again difficult concept. So which valvular lesion in this patient?
Mitral
It is
stenosis.
mitral stenosis. The severity of the mitral stenosis is determined by
Opening distance between or time interval between S2 and opening snap.
so it is a interval. It is determined by interval between S2 and opening snap. If it is
Yes.
decreased, it means increased severity of the mitral
Severity.
stenosis. If it is increased, it means there is a less severity of the mitral stenosis. So the interval between S2 and the opening snap, opening snap, if it is decreased, it means more severity of the mitral stenosis, right? So you have to expect these kind of uh, the question in your exam, right?
Okay.
Okay. So mitral stenosis is diastolic murmur or systolic murmur.
Diastolic.
It's a diastolic moment.
Okay, it's a diastolic murmur. Okay. So what is the most common cause of the mitral stenosis? It is a rheumatic heart disease. Rheumatic heart disease. 99% of the causes of the mitral stenosis due to rheumatic heart disease, right?
Yes.
Okay. So this pressure volume loop is pressure volume loop of the mitral stenosis. So what happened in mitral stenosis? Again, so this is the stroke volume is decreased. So you expect these kind of the stuff. What about end diastolic volume? End diastolic volume will
It will
decrease,
also decrease.
right?
Yes.
Okay. So what happened? What happened? This one is systole. This one is
Yes.
systole, and this remaining portion is diastole.
Yes.
So what happened during diastole? During diastole, left atrial pressure more than left ventricle pressure, right? So
Yeah.
this one is left ventricle pressure, and this is left atrial pressure, right? So this is
Yes.
diastole. You noted that the left atrial pressure is more than left ventricle
It's more than
pressure,
left ventricle. Yes.
right?
Yes.
So you expected these kind of stuff. So left atrial pressure is increased. These kind left atrial pressure increase in mitral stenosis, and systolic volume will be decreased, and systolic volume will be decreased, and diastolic volume is also decreased, and stroke volume is also decreased, right?
Yes.
So end diastolic volume is a determinant. If increase end diastolic volume, it means increase stroke volume, right?
Yes.
Okay. So I am going to discuss about another syndrome, Ortner syndrome. We already discussed about this syndrome, Ortner syndrome. So basically the left atrium is most posterior, is the most posterior part of the heart. So this is left ventricle and this is mitral valve. So more blood. So what happened? The mitral stenosis. So mitral stenosis lead to the enlargement of the left atrium, right? And the
Yes.
enlargement of the left atrium will compress the
Esophagus.
esophagus. If it will compress the esophagus, patient present with dysphagia.
Dysphagia.
Dysphagia, hoarseness of voice,
Hoarseness of voice. Why?
Yes. The compression of the
current
current
laryngeal nerve,
Yes, hoarseness of voice. So this is known as Ortner syndrome. Again, is a very high yield stuff. Okay, the last thing of today's session is the treatment. So what is the treatment of this? Which is a drug of choice for rheumatic heart disease?
Penicillin.
Penicillin. What is the mechanism of action of the penicillin? Drug of choice.
Then what? Cell wall. Axons.
So it is a protein synthesis inhibitor. Is this a folic acid synthesis inhibitor? Is this a cell wall inhibitor?
Cell wall.
Cell wall inhibitor, right?
Yes.
Cell wall inhibitor. And more precise, it inhibits peptidoglycan cross-linking. Peptidoglycan cross-linking. Okay, you have to identify the mitral stenosis murmur as well as mitral regurgitation murmur, right? It is important. If it is age less than 25, which murmur? Mitral regurgitation. If it is more than 30, it is mitral stenosis, right?
Stenosis. Yes.
Okay, so what are the side effects of the penicillin? Penicillin G,
hypersensitivity reaction,
hypersensitivity, interstitial nephritis, right?
Yes.
And sometimes hemolytic anemia. Okay, so the key thing is again mitral stenosis. Mitral stenosis murmur is diastolic murmur. Sorry, mitral stenosis murmur is diastolic murmur. It has opening snap. And what is the significance of opening snap? We already discussed, right? Mitral stenosis also increase the risk of atrial fibrillation. Although anything that lead to the enlargement of the left atrium, it will increase risk of atrial fibrillation. What is the origin of atrial fibrillation? Pulmonary vein, right?
Yes.
And mitral regurgitant murmur is hollow systolic. It is a hollow systolic murmur, right? And it
Yes.
radiates to axilla,
Yes.
right?
Yes.
And the drug of choice is penicillin, and mechanism of action of the penicillin is again important. So it is a cell wall inhibitor. Mainly it inhibits the peptidoglycan cross-linking. And the age is also very high yield. It will determine mitral regurgitation or mitral stenosis. One more thing is the histopathology. ESCOF bodies or NHSA square cell. Sometimes they give you the histopathology. ESCAF bodies and NHSA